Yeah, my insurance did blue line insurance, and it's just for first responders, and now they're being taken to court in like every state. It was just for first responders. No, they're not. And it's not that they're found out they weren't authorized to do insurance in certain states. It's like a nationwide thing for first responders.
Order City of Orgy City Council special meeting Thursday, July 31st, 2025. Let's stand for pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, have roll, please.
Mayor John Eric Hoover,
Here.
Vice Mayor Chris Mayer,
Here.
Councilman David Mueller,
Here.
Councilman Robert Hubbard,
Here.
Councilwoman Lisa Burke,
Here.
City Attorney Jay Daniel,
Here.
City Manager Andrew Butterfield.
Here. Thank you. Okay, first up is comments from the general public. I have none signed up. We have any comments from the general public? Seeing none, bring it back. Comments from the city manager. Pass to Mr. Butterfield for his comments.
Yes, sir. Mr. Mayor, Council, I appreciate everybody getting together for a special meeting. What we have before us today is the health insurance for the fiscal year 26 that we're about to start October 1st. And we have two very good options, I think. There's the option to go back into the PRM pool that the city was in for a number of years up until last September. And there's another option by going through the broker, which would lead to a UHC plan that would also make budget. Both of them reflect about a 14% increase in cost to the city over last year. There were a lot of other options that are far higher. So 14. It's the industry, and it's just how things are right now. So we've got information about that. I would also like to make an amendment to the agenda, though. We had in the last 2 days, it came out, Mr. Cruz from the water plant discovered a leak in one of the walls of the double-walled chlorine tank. And so I'd like to recommend an emergency purchase for approximately $13,000 so we can get that ordered and fixed before the second wall were to have a problem.
Yeah. Can I get a motion to add the
Motion to.
emergency purchase? Okay.
Second.
Okay. Any further discussion? All in favor, signify by saying aye. Aye. Opposed?
Aye.
Oh, sorry, Bob. Opposed? Motion carries. Okay, so we'll cover that first going in. Any more comments?
Yes, no, sir.
Okay. All right, so there's no comments from board committees. We'll move right into council business, and we'll take this emergency purchase up. So I'll pass that to you for introduction.
Yes, sir. So what we would be doing is purchasing a $1,050 gallon sodium hypochlorite bulk storage tank to replace the existing tank, which is currently leaking. I'm seeking this approval as an emergency due to environmental impacts and the inability to produce any potable water if the current tank were to completely fail. We priced it with a couple of different vendors, and prices were close, but the lowest bid was $13,000.
Yeah, I did see it on here. It's going to take them 10 to 12 weeks to get it done. Is that a week?
Yes, sir. We can. Well, I thought it was 2 weeks. I may have.
Between 2 and 4 weeks,
Yeah.
on delivery.
Okay. And we should be good until that point, you think? Hopefully.
If you have any technical questions,
Yeah, what's the solution in the meantime? What are you doing about trying to stop hemorrhage?
So basically, the kind of the danger exists when you fill the tank now.
Okay, so it's down to a certain level?
Correct. So when the next time we fill it before this delivery of the new tank, we're only going to fill it halfway.
Okay, so
The leak is above the halfway point.
It's higher. It's higher. It's about 6 feet up on the tank.
Oh, okay.
So
do they make a patch that can suffice for a period of time in case, an emergency or?
it's on the inside. So
Oh.
it's that you would have to get inside that tank.
Yeah,
So
you
it's
can't
double
breathe
walled.
that. Yeah.
Double walled. Correct.
Steel or fiberglass?
Fiberglass.
And it's failing on the inside.
Correct.
How old is the tank?
17 years old.
What's the life expectancy on a tank like that?
7 years.
7 years.
Now, is that because sunlight is exposing to them and it's helped deteriorating that? Is there something we can build over the top, a carport or something to help keep them in shade?
You can. I mean, and then the new plant design does have the tanks stored inside.
Yeah.
So, but typically when you store a tank like this outside, they last about 7 years. Inside, about 10 years.
Sounds like we're way overdue on our tank right now.
Yeah, we got almost double life out of it. Oh, you did get double life out of it.
So it's leaking past the first wall, but not the second walls?
Correct.
Okay.
Yep.
So it's not going on the ground. That was my main concern.
No.
Any other
Do you guys
discussion?
have a preference or?
What's the difference? You get a 13,000 and a 13,280. What's the difference?
Same tank. Same tank.
The same tank, just two different companies?
Different companies.
Is the best company to go with?
Well, Guardian has actually done work for us in the past. So they rebuilt our chlorine skids and ammonia skids, and they do pretty good work.
And they're less money.
Correct.
And they could transfer the chlorine from the damaged tank to the new tank when
Yes.
get it in.
Yeah. So what they'll do is they'll bring a spare tank in when they come to install the new tank. They'll take
Do the swap.
transfer it. Yeah.
A motion to approve.
Second.
All right, motion second. Any further discussion?
So we're approving Guardian, right?
Yeah, Guardian is correct.
Yeah.
Most approved Guardian. You want to restate
Motion
that?
to approve, Barry.
Okay. Second, still good? Okay. Any public comment? Seeing none, bring it back for a vote. All in favor, signify by saying aye. Aye. Opposed? Motion carries. And next up is item number 2 now, discussion of group health insurance for city employees. I'll pass it back over to Mr. Butterfield for introduction.
Thanks, Mr. Mayor. As I alluded to earlier, the PRM is a pool, and the city has good experience with that in the past. They contract with Florida Blue, and so under the broker, the city is currently under Florida Blue. So an advantage to that would be that people would stay with the same Florida Blue company and would be able to keep their doctors and things. So it's kind of comparing apples to apples with the UHC, which would be the other option through the broker. Again, almost exactly the same budget-wise and cost-wise to the city and to employees. So it's a good problem to have, two good options. The PRM, though, is an organization that you have to, that's why we had to have a special meeting, is if you go that route, you have to agree to the bylaws and sign up for that. So that's what the vote would be for. Sal and Rhonda have worked tirelessly on this. Adam's done his part too, to give us two good options, and they're available for any technical questions you might have about what we're looking at.
Okay. Lisa?
So, adding to what the city manager said, we had a broker, Marsh McLennan, that we've been working with since last year. They continue to look for all different types of plans through all the carriers. But we also reached out to the PRM, and then, since we were part of their pool, because our first initial to get back on the Florida Blue as an independent 70 employee base was almost 66% to renew. So, and that was the initial from our broker. Now the broker has brought that down some and gone back and forth with Florida Blue and all the carriers, but still way without our outside our budget constraints. The two plans that we have in front of us right now from both the broker and the PRM pool both stay within our budget and the projected budget that we're going to present for council. Actually, it's below that. What the finance director has set aside for that So either way is a really good option. The PRN pool allows us to have all the employees remain with Florida Blue as their carrier, so they won't have to do much switching as far as doctors, pharmacies, anything like that. It just be a simple transition. Switching to United Healthcare, of course, when you're switching to another carrier, you have to change everything. And then also the fact, one of the reasons why we're leaning more towards getting back into the pool increases each year are slight, as opposed to being an independent employee base of 70. When you're part of a pool, you're part of a larger base, and they basically take you're part of a large collective. Then that's what they base your insurance rates at. So we can switch to United with our broker, but the thing is, come next year, we're going to be switching to another introductory carrier at that time. And unfortunately, now there's only 4 main carriers, for the state. So sooner or later, we're not going to get any special introductory offers. They're going to know, the amount of claims and whatnot that we have as an employee base, and we're not going to get any type of breaks anymore. So by staying with a larger collective, it allows the finance director, city manager to see those increases early and be able to project them through the for the budget. So this is why we collectively are leaning towards to rejoin the pool. That way we can stay fiscally responsible and then also still provide the same insurance that the employees have now.
Thanks, Sal.
Can you walk us through the stuff that's in the packet here on page 8? There's medical benefits at a glance, and then and there's these 3 options, and then there below that where it goes into the 25-26 PRM Florida Blue plan. There's 3 options as well, which I'm assuming this is what the recommendation is to go with these. This is what the pool provides.
The page 8 is what we currently have right now. That's
as of today.
Those are our today's plans. Yes, that's what we have right now. Our recommendations for the PRM are on page 10.
Okay.
That's the current plans that they're offering right now, and what we have in red is basically the changes to those plans.
Are those 3 plans, if you follow it straight down, are they in the same order as the top ones? The numbers are different. So
the numbers are different because they're different plans. What we don't have in here is an HSA plan as we did this year, because I included a memo from the finance director. The scope of the HSA has changed as far as the administrative fees, and what our end of contribution would have to be would significantly jump up. So we did not include an HSA plan in the spread this year. So the plans for what we see here is the plan that we offer all our employees at a $1,500 and $4,500 deductible, and then the other 2 plans are buy-up plans that the employees can go ahead and out of their own pocket buy up to those plans.
because it doesn't show on here what the for like the spouse, family, the children. It doesn't show those rates in here. It just shows that, I guess, on the green column, the city pays 100% of that.
Yeah,
and it says 1123. I guess that's the city's portion for the month, for the year, for the.
Yeah, it'd be 1143 a month
Per employee, one person,
one person.
not the family. So what do they do when they have a family?
Well,
Those upgrades?
the family plans usually are
Very pricey.
almost double or twice as much.
But they pay that.
They pay that. Yeah, they want to add their spouse or children. They have to pay that. That comes out of their pocket. We only for the employee only.
This year we only had one employee that had added his spouse to it, and it was expensive. And as of right now, he actually took them off, so we don't have anybody that has children or a spouse to their plan right now.
Doesn't that seem like a broken system?
It does.
It is. I mean, we're at $1,100 a month.
Is that a month or is it pay period?
It's a month
It's a month.
Okay.
per person, per employee, and they can't even have their spouse or their kids on it. And if they want their spouse or kids, it jumps to $2,000 a month, and they got to pocket out of their pocket $1,100 some dollars.
Yeah.
That's a broken system.
Do we ever get the claim payments history?
Like a summary of everything we spent.
So we got billed right at 720,000. I have not seen anything that showed what we actually paid, the insurance paid out. And we were talking to someone, and he said that could be somewhere in the half range. So what they actually paid. So our billed amount was $720,000, but we probably paid roughly maybe 350, 400,000. But Marsh McLennan did not give us access to those numbers from there. So right now our billed amount was 720,000,
So what do you
which
mean
is
by-
slightly less than what we paid.
What do you mean by billed amount? Is that what the insurance company billed us?
No,
No, that's what hospitals and doctors billed the insurance company, 720.
Okay.
Hospitals
That's
bill.
not a real number.
So let me just
Right, that's what I'm saying.
let me-
We don't have the paid amounts.
well, let me put this in the context here.
Pay out.
Insurance
That's what I'm telling you.
Premium. They
Hold on.
told us.
That's what I'm telling you. We don't know. They didn't give us that information. What
So-
we all had was the billed amount.
So if I could here, the billed amount was 720,000.
Correct.
Based on these numbers here, if you take $1,123 per person times 12, sorry,
That's around
1123 times 70 employees times 12, you get 940. So $1 million is what we're paying in insurance. And if we're getting billed 720, we just lost 300 some $1,000. Why are we not self-insured? That's my question. And last year was a big year because we had a kidney transplant. So why are we just throwing money out the window? Why are we not looking at self-insuring ourselves?
Oh, we absolutely can, but I mean, again, you're looking at those things. You're looking at a kidney transplant, if possible. Somebody lose an arm, we have those things. I mean, those are big liabilities. And yes, we don't have that option to go and say, hey, we're only going to pay you this amount of money. The insurance companies does. That's why what our billed amount is not what was actually expended on our behalf. That's what I'm saying.
Right,
It's probably
so less than
somewhere
that. Like I said, probably half. So
right,
what,
but we don't have that ability to go to these hospitals and say we're only going to pay you $100,000, not $250,000.
well, right, but so the way self-insurance plan administrator, they have administrative services only, and so what they do is that's where you get the negotiation of the rates and all that. But they're just administering the plans, much less than actually them taking the risk. If we take the risk and we pay the claims, that's a much less administrative services only type of arrangement.
And you have a reinsurance above a certain level that kicks in
Sure.
should we not be able to foot the bill.
I mean, that's absolutely something we can look into. But this is a much easier option for us as far as
Well, it's
we
much
just pay
easier
it.
because we're paying out the yin yang for it, right? So
But if you look at it, I think what we were paying $988,000 a month. What we was paying roughly before, I think it got to be like $780 is what we paid. Our billed amount was $720. I mean, the insurance company obviously made some money, but again, they didn't share the amount that they would have made. I mean, that would actually paid out.
all right, and that's
Yeah.
fine. I think the bill number is more than enough to show that we know they're not paying out what the bill is because those billings are ridiculous. I can tell you that it's probably less than half.
Well,
You look at some of these
I
rates.
agree with you. We can absolutely look at a plan where we are self-insured, but I think that's something you have to build on. We can look into that next year and say, okay, because obviously it's going to go up next year as well. So we look at it and say, okay, we cap ourselves at, let's say $850,000, whatever. So we take that $1,128 we're going to pay per month this year. We put it in the bank, and you're exactly right. We can pay those out. But I think there has to be a plan, and we have to get someone to work with us. So it's not something that I think we can hop into this year unless we just say we're not going to be able to self-insure and just let the bills roll in without some kind of help with that.
These are the exact things I was referring to that we would have learned by going to trade shows that other municipalities go to, and we hang out with other folks. Hey, what do you guys do for insurance and that kind of stuff? And they're like, well, we do the self-insurance thing, and here's how you do it. That's how in the car business we learn those things. We get around smarter people than us and ask them a lot of questions. So it may be a great opportunity for us to double down on that meeting that we talked about, going to these trade shows that have to do with municipalities.
Yeah.
Because this is pretty heavy, 14% increase, no end in sight.
Yeah. Well, I mean,
But then we'd have to hire somebody just to handle that.
you would still have a carrier that would do the administrative services on
Of
it.
course, you're still paying administration.
And I don't know what
Yeah, that's the thing. I couldn't give you a number on that. And that's why it's something we can definitely look into. But it's something we've never looked into because, again, the year that I've been here, no one's come to me and said, hey, this is an option for us. So going that route, we've all followed suit what we've been doing for the last couple of years.
It's a gamble as well because could you have a really good year and very low claims? Yes, and then that way you'd be under that bar. But then you can then there's the financial risk if you have high claims, and then we're still going to have to pay that out because
Right. No,
as self-insured, we're paying the claims
No,
directly.
it's
So, I mean, there is a risk in that where being fully insured, it's your set premium is it's a budgetable amount that you go forward each year and present that. So that's the gamble in that. So can you go in that route? Yeah, but like I said, you have to even if you set a certain amount of 900,000 or whatever to match that for the year, got to hope that we don't go over that because then you go over budget. So all depending on the claims. So
right. So the hard part about making a switch like that is that first couple of years, right? But over a long period of time, once you kind of go down that route, you find that if you look, insurance companies are out there, they're making tons of money. I mean, tons of money, and there's a reason because it's a lucrative operation. I think you got in your personal business, you do some insurance stuff, I think, as well, right?
We own multiple reinsurance companies ourselves, and we reinsure service contracts. In other words, cars. There's a couple 3,000 of them running around there that have service contracts. We own the service contract, we pay the claims, and there's still lots of money left over at the end of the day. But we manage it closely.
Right, you have to.
You got to have a good administrator. You can't have an administrator. It's like check, sure, pay it all, because then all of a sudden you're upside down and we're in default. So you have to have a good administrator who's got a track record of being, it's just like the insurance companies when you go out and get work done at a doctor and they send in a $3,000 bill. They're like, no, max we're paying $850, and they send it back to them. And then they chop it down from $3,000 to $850, and it's a reasonable thing, and everybody's like, okay, and they just sign off on it. That's the kind of thing we need in place for bills.
If you're thinking about it, and again, we could sign some kind of MOU with a walk-in clinic, and that could be, whatever. I mean, I think there's options out there. I think we're too close to the beginning of the fiscal year, and if that's something that you guys want us to look into, we absolutely can look into that to try to save money. The only thing we're self-insured for in this city right now is just our workers' comp, or unemployment. I'm sorry, is the only thing we're uninsured for. But you're exactly right. Things are going up. I mean, just for our workers' comp insurance, I think we're close to $700,000 just for that. I mean, it's just something that you have to have.
Adam, I don't see. I'm sorry.
No, you go ahead.
I don't see you walking into a local clinic. That's not what I'm talking about. Because I wouldn't send anybody to one of these little roadside clinics. Okay.
Typically, if you're going to self-insure, you contract with United
MediShare, one of these big companies.
Blue Cross, and you define the plan and the benefits that you want, and they do the claims administration. But ultimately, it's us to pay the total.
After whatever the insurance company would be paying, that comes from us.
But I agree with you, Adam. I think it's a great idea. I think it's a little late getting out of the blocks. It could possibly work. I don't believe there's a time frame that we're up against that's going to curtail us from moving forward with something like this. But certainly, if we move forward with one of these options, that ought to be on job one, and a goal for 2027 to start the process immediately and start looking.
Yep.
Possibly we can change horses in the middle of the stream. I don't know, but that could work as well.
And while we're doing that, obviously, let's get as much information as we can and do that analysis similar to what we did. Let's see what our bill claims were, and then
Paid claims.
what we were billed. They won't tell us what was paid.
Another problem we had was when we switched from PRM to the Marsh McLennan, it was very hard to get our information. They held tight to it, and just we had to get it audited this year.
It's kind of hard to justify a huge 15% increase if we know
making 35%.
Or making a ton of money, right?
Like he's saying, it's very possible to go do that, but we're small. 70. If we were in Tampa, I kind of agree. We'd probably get a really good deal on there. But I think we're gonna get smashed around because we're only 70 employees. I mean, we're not huge. And again, I'm only saying that because I don't know. I know that we're 70 employees with this. It was a 60% increase. I couldn't imagine going somewhere on our own and saying, hey, this is what we want. 70 employees and someone giving us a fantastic deal where nothing's changed and nothing goes up, and every year it's kind of the same. But it's something I don't know about.
Yeah.
So it's definitely something we can look into.
In my mind too, being small should work the opposite. I would think that it's be less risky though, right?
There's not as much pool.
I get that, but
Now,
you
one
just,
hit-
you also don't have as many people that can have these catastrophic problems. either,
Right, but if you do have one, you take it in the short.
Well, right, you have
But
less
you're
people
still going to
spending.
have to make these
Absorption,
payments every month because you're going to have to build a reserve over time.
Right.
This thing eventually is going to get traction and you'll be able to cover that, but the risk is in the first couple of years.
Yeah, I think if we go with this for now, I think the very next step is looking at see how we can get off.
And Mayor, I
Well,
think
one thing-
you've got a team in place that is obviously open to finding the very best value for the taxpayers' dollars. These folks have worked hard for this. I think what I've heard is it's a little late in the game for this year. I agree. I think we need to pick one of these for this FY. But the very next thing we do is start looking at other options. In fact, I need to duck out.
Well, that's right. You need to go.
I've arranged to meet with the city manager of Newport Richey and the county administrator this afternoon to talk about what they use and what they do. We might be able to join a pool. I know a county I used to work for is self-insured, and I'll reach back and
Get some
of course,
details on that.
much bigger pool, but there may be an ability for us to join a pool with our county, for example.
Well,
So I look
That
forward
was
to
one of my questions is have we checked in with Pasco in the state of Florida to see if we can join there?
I hadn't in my time here yet,
We
but
did.
again,
We actually did reach out to Pasco County about, because I was very interested in the fact that they have their own clinics and stuff. We have one right up the road that's in Pasco County. They said no. So it's not something that, so I was like, hey, can we just, pay y'all $400,000 or $500,000 and be able to go to this clinic, kind of like what they offer with their thing. I did that at the school board as well, but it's not one of those things. But I do want to share the bank that we are working with right now to kind of transition our business to. It's a bank and trust. And Matt brought a thing to me about building a trust for some maybe self-insurance for flood insurance and stuff.
Yeah.
I know they're very good at that kind of thing. So I'm going to reach out to them too and see if, on their trust side if they have something we can do and if it makes sense for us. So we can bring options back. Absolutely. I think that's a good idea.
Sounds like you got some plans. I appreciate that.
And honestly, if you want to do something like that over a few years or whatever, you build that claim fund that we would use, and then we'd be in a good place going forward, and we could control our own rates.
Yeah, we don't want to just build a fund without being some kind of trust where we don't pay it out unless there's got to be a collective. That's one of those things we were working with the flood insurance. It's not something that would have, we're still working on, so there's no, but I think that's a good place to start.
So to clarify, the ask is the ask to approve, Mayor, is the ask to approve the motion to approve the city of Port Richey back into the PRM for now. Is that the request?
Yeah.
So that's my
That's the
motion.
recommendation.
Okay,
right?
so we got a motion to move back into the PRM.
Correct. Move back is the number one choice on the page. You're going to read the whole thing?
No, you're good. That's good.
Okay.
Is there a second?
Second.
Okay. Any other discussion? Did you have something to say, Lisa? I know you.
No, it got answered while you were over
If I could caveat that by saying we start now with looking into self-insuring and what the possibilities are to have somebody else administer for us, because if we're kicking $1 million a year in there, and we could actually do it for $750, maybe let's just say what it is, $100,000 in administration fees. So now you're an extra $150,000 a year we're saving. Well, that's $1 million over 10 years that we're putting away into a fund that's maturing and making money too. So
But we need to do more than just talk about it. We need to assign that task to some person or some department so that it gets accomplished and tracked and followed up on.
I think I just did, didn't I?
Yeah. So obviously, let's act on this motion, and we'll come back and we'll
Okay.
get consistent.
Just for clarification, two things. Who seconded?
Dave.
Okay, and can we clarify the motion because it's rather lengthy and I
I'll
just
read
want for the minutes.
I make a motion to
sense.
approve the city of Port Richey back into the PRM Group Health Trust with Florida Blue as a carrier. Agree for the mayor to sign the PRM bylaws cooperative agreement and designate city manager Andrew Butterfield as the primary group health trust board member and Sal Akari as the alternative.
Thank you, sir.
Second.
All right. Motion second. Any
I
further discussion?
appreciate that.
Bob, do you have any comments?
Well, I was just wondering, Adam was talking about, he talked to Pasco County about being in their insurance group there. I didn't know what was the answer to that. I kind of skipped over some of that.
The
So I
initial-
didn't hear what the results was.
Yeah. The initial thing was no. I actually introduced Andy to Mike Corbala yesterday over text, and there's a meeting today that he was going to be at anyway. So he's going to talk to both Newport Richey and Mike there with the county to kind of see what they're doing, and obviously if something different comes from that, it's something that we could possibly do, we could always probably come back and switch this real quick. But as of right now, we're going to move ahead with this.
Well, our open enrollment is literally right around the corner.
Right.
I know Newport Richie went out to RFQ for for their own broker this year, so they're in the process. They're in the process of doing a broker. I believe they renew that every year. But as doing some sort of joint effort with them, that's something we can definitely look into as another option as part
Going
of
forward.
Self-insured to move forward. I think we should really start this more sooner than later. If we're going to do that
Tomorrow.
So I think between myself, the city manager, and the finance director, we can definitely get those questions moving forward on those things.
Yeah, that would be great, because I mean, you get a part of me, part of Pasco County, obviously, I mean, you can't do it by yourself. You're just not going to do it by yourself. And hiring an administrator to do that is you're kind of taking another hole, trying to get out of it. So I think that we can be a part of it, like the school board and Pasco County, and be a part of that group.
You're breaking up, Bob.
Yeah, Bob's his sound.
But let them look at it, and otherwise, I'm all for it.
He approves.
He's good.
And Adam, you indicated that you spoke with somebody in Pasco, and I guess
Adam said he did.
and going to follow up with.
Not Andy, Adam. Adam did.
Yeah, but Andy just left the meeting. He's going there to talk with Mike and them at this other meeting as well.
So
my
you had a conversation with somebody down here. He's going to the top.
Right. My conversation was more leaned towards allowing us to join their group as far as their clinics go, not so much
Right.
joining their thing. So that was a no on that.
I think being a part of
Okay.
the pool, I think they'd be indifferent because it increases the number in the pool, which typically drives the cost down. And by the same token, if Newport Richie has not joined a pool like that, potentially bringing both of them in, and everybody wins, right?
Yeah.
So-
The economies of scale is what you need to be. For sure.
So I think we're good, at this point.
Okay.
And then if something better comes along, we still have time to react.
Okay. Any public comment? No, we got some public? Okay. Seeing none, I'll put the vote. All in favor, signify by saying aye. Aye.
Bob said aye.
Opposed? Motion carries. Okay. That concludes council business. Any old business?
But did you want to follow up on the follow-up?
Oh, yes. By consensus, is there any objections to, obviously, staff moving forward to looking at other options immediately?
No.
For how we ensure going forward?
It's not that there's no objections, but I think we need to get a plan. We need
That's,
to put,
by consensus, we're telling them to act on that.
okay, and you're taking notes on that. We got that in the minutes.
We definitely did, because the same reason we are part of dispatch with Pasco County, it just it's more efficient and makes more sense. Same reason Adam, Sal, Andy need to look into that, absolutely.
Yeah.
Bring options to the table.
So by consensus, we're going to task y'all with moving forward and finding good solutions. All right. Any old business? All right, comments from mayor and city council. Start with Councilman Mueller on his last official meeting.
I am good.
Okay. Councilwoman Burke, Vice Mayor.
I'm good too, sir.
Councilman Hubbard?
No,
Okay, I as well as nothing, so on for motion.
Motion to adjourn.
Second.
All in favor, signify by saying aye.
Aye.
aye.